4, number needed to treat, or NNT. This is one of my favorite measures because it's so immediately practical. It translates statistical findings into a concrete, real-world question. How many animals do I need to treat to prevent one case of disease? That's a question every clinician and every producer can understand and act on. Number needed to treat is the reciprocal of the absolute risk reduction. It's that simple mathematically, but conceptually, it's incredibly powerful. An NNT of 1 would mean every single animal you treat benefits. That's the theoretical ideal. An NNT of 100 means you'd need to treat 100 animals to prevent just one case. In herd health medicine, where you're often making population level decisions, NNT helps you weigh the cost and logistics of treatment against the expected benefit. The formula is simply 1 divided by the ARR. Make sure your ARR is expressed as a proportion, not a percentage before you divide. So if your ARR is 20%, you use 0.2 in the formula. 1 divided by 0.2 gives you an NNT of 5, meaning you'd need to treat 5 animals to prevent one case of disease. Always round NNT up to the nearest whole number, since you can't treat a fraction of an animal. In practice, NNT is a fantastic communication tool. Telling a producer this vaccine has an NNT of 10 means that for every 10 animals vaccinated, one case of disease is prevented. If they have a flock of 500 sheep, that translates to roughly 50 prevented cases. And suddenly, the cost-benefit calculation becomes very concrete. You can also flip this concept to calculate the number needed to harm, or NNH, when evaluating adverse effects of treatments. Building directly on Module 3 here, you've already done the hard work. The ARR is 0.2. Now just apply the NNT formula and think about what it means for a 600-horse breeding operation. How many cases of Strongyle infection would you expect to prevent if you treated the whole herd? 1 divided by 0.2 gives us an NNT of 5. That means for every 5 horses treated, one case of Strongyle infection is prevented. Now scale that up. In a 600-horse operation, treating the entire herd would be expected to prevent approximately 120 cases of infection. That's a number a farm manager can work with. They can compare the cost of treating 600 horses against the cost of managing 120 cases of strongylosis, including veterinary care, lost performance, and potential mortality. NNT makes the math real.